Hey drivers, YouTube's DOT physical expert Dr. Nuesse back again with another video on how to be a commercial driver, a CDL driver, and stay in compliance with your medicals. And in this one, we are talking about the big four conditions that you are going to be checked for, that the FMCSA, the Department of Transportation, has very clear standards on, that they want you to fall within their standards. There's no wiggle room for the providers. These are the big four conditions. They're listed right on the FMCSA's paperwork, the long form that we fill out as medical providers. And let's go over each one of these and what the parameters are, because if you can pass these four, if you're in compliance with these four and you have no other real significant medical history, you'll be in real good shape to pass your DOT physical and be able to keep your medical card. All right, so let me put up on the screen now the form that we're actually going to fill out, and I'll show you the big four, what we're going to be looking for, that the FMCSA is very clear on the standards that you cannot fall outside of. So here we're looking at the big four, and we're calling it blood pressure, vision, hearing, and your urinalysis. There are very clear parameters. That's why these are the four listed on the sheet. If you scroll down, if I show you the bottom of the sheet, it lists the rest of the physical examination. Again, we're going to be checking your heart, we're going to be checking your lungs, we're going to be checking your nervous system, all of these different things. But a lot of that is under the medical examiner's discretion of whether we think it is safe for you to operate a motor vehicle. So a lot of that's under the medical providers, the doctor's discretion, whereas the big four are not. They're standards set up federally by the FMCSA, the Department of Transportation. Okay, so let's go through these one by one so you're very clear on what we are looking for, the standards that you have to fit in, and how long you could potentially be certified for. And the first one on the big four is blood pressure. Now, we need your blood pressure to be below 140 over 90, and that can be even if you're taking medication. So if you come in and you're not taking any blood pressure medication and we read 140 or less over 90 or less, we are going to be able to then certify you for 2 years or up to 2 years depending on the rest of your evaluation. If you are on medication, you need to be under 140 over 90. And we will only then be able to certify you for 1 year. So if you're taking blood pressure medication to control your blood pressure, even if it's low, even if your blood pressure is low when you come in, if you're taking medication to control it, your maximum certification is going to be 1 year. So 140 over 90 is kind of the cutoff. Now, if you go above that and you are 140 to 159 or 90 to 99, we can give you then a 1 year certification without sending you to be seen by another doctor. But the next time you come in for your examination, you're going to then have to be under that 140 and under 90 limit. So 140 over 90 is going to be then what you need to be under to be certified again. We can't just keep giving you a 1 year certification if you're over 140 over 90. Now, if you're 160 to 179 over 100 to 109, we can then give you a 3-month certification in order to be able to be put on medication by your medical doctor. But then when you come back within that next 3 months, you're gonna again have to be under that 140 over 90. And then if you are over 180, if we read you over 180 and then or over 110, you're going to be medically disqualified. We're not going to be able to certify you at all. Now, when I take blood pressure with clients, patients, drivers, when they come in to get their DOT physical done in my office, Easy DOT Physicals is our office, and you can learn more about us on that website. But when somebody comes in to get their blood pressure taken in my office and I do it, I will take it at the beginning. The first thing I'll do, I'll ask them a couple questions, but then I'll take the blood pressure. And if they're high, potentially that could be just because they're nervous, they haven't met me before, we're talking about health conditions. It's called white coat syndrome. So when that's the case, I will take it then again a little bit later once they've calmed down a little bit, sat and relaxed. And again, so we can take it multiple times to try to get it down, but eventually we need to get it down into those parameters in order to be able to certify you either for 1 year, 3 months, or for the maximum 2 years if we have a regular blood pressure reading, again, under 140, under 90. Okay, and second on the big four is vision, and there are 3 components to the vision evaluation. 3 and 3 only. If you pass the 3, you're within the federal guidelines. So the component number 1 of vision is your visual acuity at 20 feet. So we are looking for you to be in both eyes at least 20/40 vision. 20/40 vision in your left, 20/40 vision in your right, and together. And that can be with glasses or without. So you can wear your glasses during the examination, you can wear contacts during the examination, but if you do, we're going to put a check in the box that you need to use corrective lenses while you are driving. So if you pass without, we just don't put a check in that box, but you have to be 20/40 in both eyes, not just in one eye. You have to be 20/40 in both eyes. The next thing that you have to be able to do is you have to be able to see with a field of vision in both eyes 80 degrees. So you have to be able to see 80 degrees in your peripheral vision. We will typically do this, or I will do this in the office by putting my finger behind your back and bringing it around to the side of your head. And then when you can see it, you will say, I can see it. And as long as that's 80 degrees or better, then you will pass that component as well. And again, that has to be in both eyes. And then the final thing for the vision component that the FMCSA requires is that you are able to tell red, amber, and green, the colors of a traffic light. So I will just point to something, and I've got a little paper made up that's got a red bar, a green bar, and a yellow bar, and I will just point to each and say, what color is this, what color is this, what color is this? And if you can identify those 3 colors, then you will have passed that component. You pass all 3 components, and you've passed the vision component, and that is second on the big 4. All right, and next let's talk about the hearing exam, because again, very clear standards from the FMCSA about the hearing component. And in this case, we will do a whisper test. So in the office, this is a very rudimentary test. We will stand at least 6 feet away from you, out to the side, and we will test one ear by whispering and having you repeat back what we say. So typically what I will do is I will stand to your left side, I will have you look straight ahead, and I will say numbers. I will say 1, 5, 3, but in a whispered voice, and you will just repeat back 1, 5, 3, and then I'll go to the other side and do the same thing. And here is the standard. This is different from the vision standard, is you only have to be able to hear it 6 feet away in one ear. So you have to have one good ear that you can hear a whisper at least 6 feet away. So if you are not able to hear a whisper at least in one ear from 6 feet away, again, this is kind of a rudimentary exam, then we can send you to a hearing specialist to get your hearing actually tested and professionally, and then that hearing specialist can clear you as well. So that is the hearing standard. That's third on the big 4. All right, and finally, as part of the big 4 is the urinalysis. We are going to be collecting a urine sample. Now, I've done a very complete video on the urinalysis component of the DOT physical. What we are not doing is we're not drug testing during the DOT physical. What we are looking for is protein, blood, and sugars in your urine, which can indicate a number of different internal medicine disorders. So if one of those shows up to any significant amount in your urinalysis, we are most likely then going to want to send you to your medical provider to rule out some of these diseases. That is a very, very important point, is we're not drug testing, we're testing you for some of the internal medicine disorders that can show up through a urinalysis. Kidney disease, diabetes, things like that. All right, and final thoughts here is there's a number of other parameters that, there's hundreds of other parameters that the FMCSA Department of Transportation says are important as far as the DOT physical and what they tell providers. Things like sleep apnea, being able to obviously use your limbs appropriately, having good strength, good reflexes, good range of motion. There's a standard on people that smoke. There's all these different parameters that the FMCSA directs the medical providers to look for. But these are the big four that are right on the DOT physical long form that there is really no interpretation about. If you fail one of these parameters or fall outside one of these parameters, we just can't certify you or certify you for the maximum amount of time. Everything else really is up to the provider's discretion with some guidance from the FMCSA. All right, I hope that was very, very helpful and helped clear up some misconceptions. Please continue to subscribe to this channel because when the FMCSA makes updates, I'm making new videos. So subscribe, hit that bell, and until next time, drivers, stay safe.